My name is Hilary Vernon. I'm a professor of genetic medicine and pediatrics at Johns Hopkins University School of Medicine, and I direct the Mitochondrial Medicine Center and the Barth Syndrome Interdisciplinary Clinic at Johns Hopkins. Barth syndrome is a mitochondrial disorder that affects about 200 to 250 people in the world, and it affects the way sort of the membrane or the layer around the mitochondria functions. There's a defect in a molecule called cardiolipin. This generally only affects males, and because it's an X-linked disorder. And the clinical features of Barth syndrome are cardiomyopathy, so heart disease that starts quite early, almost sometimes even before a baby is born. Immune deficiency, so they have low neutrophils and can't fight bacterial infections, and skeletal muscle disease. So several years back, we became interested in looking at a molecule called SS31 or Elamipretide because it interacts with the defective molecule in Barth syndrome. And so after some laboratory and preclinical work, we were able to embark on a clinical trial to look at the effects of Elamipretide in 12 young men with Barth syndrome. And we were looking at outcomes like skeletal muscle strength, quality of life, and some heart outcomes. And it's been a long road. I think we've been working with the FDA for 4 years on this, through working through various divisions and many meetings, as well as an advisory committee meeting that did have a favorable vote, but unfortunately the most recent NDA was rejected, which is quite disappointing. A little bit hard to swallow right now because it's really important for our patients to see success. But hopefully with accelerated approval we may be able to see a path forward. I think there's a lot of conditions that we have to see met moving forward, and where that accelerated approval will go. I try to be very positive, positive for our community, positive for the patients, and also positive for all the people who have put in all of the work on moving this forward. So the positive things that I can say is that I've seen the difference this has made in my patients. I believe that this is an effective agent that has offered benefit for people. I think it's very positive that drug companies are willing to invest in ultra-rare diseases and really invest with all their hearts and continue to move forward as best they can in the environment that we're in. And also positive in the advocacy and sort of the way this brought people together to really fight for a common cause, to fight for their patients and fight for their families and fight for themselves. And so I think all of this was really, were these extra added benefits to this program beyond just the drug itself.